7 common signs of aging, their physiological background, and preventive strategies. Number 1342, August 31, 2025. Gerald C. EclaireMD Foundation. Category: Aging. Abstract. The author, a 78-years-old male, recently experienced his hemorrhagic stroke, caused by advanced vascular stiffness, pulse pressure exceeding 50 mm of mercury, combined with an acute hypertensive episode. Systolic blood pressure at 175 mm of mercury. This unfortunate event compelled him to confront the unavoidable reality of aging. Consequently, he has undertaken a series of research studies, focusing on the aging process. Aging is a universal process that progressively impacts every system of the human body. While wrinkles, gray hair, and posture changes are visible indicators, aging also manifests through subtler, yet clinically significant functional declines. This article highlights 7 common signs of aging, explains their underlying physiological mechanisms, and, importantly, outlines evidence-based preventive measures. By understanding both the pathophysiology and the available interventions, individuals and clinicians can approach aging not as an entirely uncontrollable process, but as a partially modifiable trajectory, in which lifestyle and environmental choices may slow decline, reduce complications, and help preserve quality of life. 1. Slower walking speed. Muscle aging. Muscle mass and strength decline steadily with age, a process known as sarcopenia, loss of type 2 fibers, reduced mitochondrial efficiency, and hormonal decline. Testosterone, growth hormone, IGF-1, contribute to reduced mobility. References 1. Neuromuscular junction degeneration further weakens force production. Clinically, slower gait speed is strongly correlated with frailty, falls, fractures, and mortality. References 2. Even a minor reduction in walking pace is predictive of reduced survival. References 3. Preventive strategies. Resistance and balance training preserve muscle strength and reduce fall risk. Adequate protein intake, 1.0 to 1.2 grams per kilogram per day, with leucine-rich sources. Both animal and plant-based, stimulates muscle protein synthesis. References 4. Vitamin D supplementation supports muscle function and balance. Daily walking preserves neuromuscular coordination. Large cohort studies, Harvard, NIH, JAMA 2019, show that 7,000 to 8,000 steps per day reduce premature death risk by 50 to 70% compared with fewer than 4,000 steps. Health benefits rise sharply up to about 7,000 to 10,000 steps per day, but add little beyond that level. These interventions not only slow muscle aging, but also enhance independence and longevity. 2. Eating less, weight loss, and fatigue. Metabolic aging. Metabolic efficiency decreases 1 to 2% per decade after midlife, primarily due to reduced lean mass. Hormonal changes in leptin and ghrelin blunt hunger cues. References 5. Unintended weight loss, particularly of muscle mass, signals frailty and increased morbidity. References 6. Fatigue further reduces physical activity, accelerating decline in a vicious cycle. Preventive strategies. Nutritional support, small, frequent meals rich in protein, healthy fats, and micronutrients. Omega-3 fatty acids improve metabolic health and reduce inflammation. References 7. Hydration prevents fatigue and aids digestion. Screening for underlying conditions, e.g., malignancy, hyperthyroidism, ensures weight loss is not overlooked. Metabolic aging can be slowed by dietary counseling, regular activity, and early medical evaluation. 3. Reduced sleep hours. Neurological aging. Older adults experience reduced slow wave and REM, rapid eye movement, sleep, with frequent awakenings. This stems from circadian rhythm disruptions, diminished melatonin production, and degeneration of sleep-regulating neural circuits. References 8. Poor sleep accelerates vascular, metabolic, and cognitive decline, while inadequate glymphatic clearance of beta amyloid increases dementia risk. References 9-10. Preventive strategies. Sleep hygiene. Maintain regular schedules, avoid screens, electronic device with a lighted display, before bedtime, and keep a dark and quiet sleep environment. Daytime light exposure strengthens circadian rhythm. Avoiding caffeine, alcohol improves sleep quality. Moderate evening exercise promotes deeper sleep. Melatonin supplementation may help in selected cases. References 11. Improving sleep restores resilience across multiple domains, including cognition, mood, and immunity. 4. Slower wound healing, immune system aging. Immunosenescence reduces immune surveillance and repair mechanisms. Older adults exhibit impaired T cell and B cell function, weaker inflammatory responses, and slower collagen remodeling. References 12. This explains longer recovery from surgery, higher infection rates, and reduced vaccine responses. References 13. Immunosenescence also drives inflammaging, contributing to cardiovascular disease and neurodegeneration, references 14. Preventive strategies, vaccinations, influenza, pneumococcal, COVID-19, remain vital, even if responses are weaker. Antioxidant-rich diets. Fruits, vegetables, polyphenols, support immune resilience. Zinc, vitamin C, and vitamin E aid wound healing. Regular moderate exercise enhances immune function, references 15. Stress management and adequate sleep reduce immune suppression. Preventive immune support reduces complications and improves recovery trajectories. 5. Memory loss or forgetfulness, cognitive aging. Normal aging brings occasional forgetfulness, but persistent memory impairment may reflect mild cognitive impairment or dementia. Neural atrophy, synaptic loss, and reduced neurotransmitter levels impair learning and recall, references 16. Hypertension, diabetes, and hyperlipidemia accelerate vascular contributions to cognitive decline, references 17. Preventive strategies. Physical activity improves cerebral perfusion. Cognitive stimulation, reading, puzzles, learning languages. Academic research work strengthens synaptic and neural plasticity. Social engagement protects against dementia progression. Mediterranean-style diets with omega-3s and polyphenols lower Alzheimer's risk, references 18. Control of blood pressure, glucose, and lipids slows vascular-related decline. Memory decline reflects systemic health, and prevention requires both mental and physical lifestyle interventions. 6. Dizziness when standing up, neurological and vascular aging. Orthostatic hypotension, a sudden drop in blood pressure, when standing up from sitting or lying down, is common in aging due to reduced autonomic reflexes and arterial stiffening, references 19. This transient drop in cerebral blood flow causes dizziness, raising fall and fracture risks, references 20. Repeated hypoperfusion, inadequate blood flow to an organ or tissue, may contribute to cognitive decline, references 21. Preventive strategies. Rise gradually from lying or sitting positions. Maintain hydration and electrolyte balance. Compression stockings improve venous return. Wearing tight elastic socks that gently squeeze the legs and help push blood back up from the legs to the heart. Moderate salt intake may help if blood pressure allows. Balance and core strengthening exercises lower fall risk. Medication review is essential, since antihypertensives often worsen symptoms, references 22. Managing orthostatic hypotension, a sudden drop in blood pressure, when you stand up after sitting or lying down, reduces both acute injuries and chronic decline. 7. Irregular bowel movements, gastrointestinal aging. Aging slows peristalsis, the wave-like squeezing motion of the digestive tract that moves food, liquid, and waste through the stomach and intestines and reduces digestive enzyme secretion. Polypharmacy, dehydration, and reduced mobility worsen constipation, references 23. Alterations in gut microbiota contribute to systemic inflammation, insulin resistance, and cognitive decline, references 24. Preventive strategies. High-fiber diets, vegetables, fruits, whole grains, promote bowel motility. Adequate water intake prevents constipation. Probiotics and prebiotics support microbiota diversity, references 25. Daily walking and physical activity stimulate gut function. Medication review avoids drugs that impair motility. Gut health is integral to systemic health, influencing immunity, metabolism, and even cognition. Conclusion. The 7 signs: slower walking, unintended weight loss and fatigue, reduced sleep, delayed wound healing, memory decline, dizziness on standing, and irregular bowel movements, illustrate the systemic and interconnected nature of aging. Each reflects a unique pathway of decline, but also offers opportunities for intervention. Aging is not merely an irreversible downhill trajectory. Preventive measures through lifestyles, exercise, nutrition, sleep optimization, immune support, cognitive stimulation, vascular management, and gut care can provide leverage to extend health span. Recognizing and addressing these signs early allows both patients and clinicians to move from reactive treatment to proactive aging management. Appendix, note on language. The author apologizes for using certain medical terms in this article. He has tried hard to rely on plain, simple words whenever possible. Earlier in his career, he built world-class semiconductor chips for everyday consumers. That experience taught him how to communicate with both engineers, who relied on complex technical language, and consumers, who preferred clear and simple explanations. For example, he once explained integrated circuit chip design by calling transistors meatballs and electrical wars spaghetti. Consumers laughed at this analogy, but they also understood the complexity right away, because mixing spaghetti and meatballs together illustrated how tangled chip design could be. In the same way, he now chooses to share his health and medical knowledge in plain words for patients as much as possible. Medical doctors often use jargon that patients cannot understand. but his goal is always clarity and usefulness rather than complexity. References: 1. Cruz Gentoft A.J., et al., Sarcopenia, European Consensus on Definition and Diagnosis, Age Aging, 2010. 2. Abalon Van Con G., et al., Gait Speed at Usual Pace as a Predictor of Adverse Outcomes, J. Nutra Health Aging, 2009. 3. Studinsky S., et al., Gait Speed and Survival in Older Adults, JAMA, 2011. 4. Fielding R.A., et al., Resistance Training and Protein Intake in Older Adults, Cur-Op and Clin Nutra Metab Care, 2014. 5. Morley J., Anorexia of Aging, Physiologic and Pathologic, M.J. Clin Nutra, 1997. 6. Fried L.P., et al., Frailty in Older Adults, Evidence for a Phenotype, J. Gerontolabile Sci Med Sci, 2001. 7. Bauer J., et al., Evidence-Based Recommendations for Protein Intake in Older People, Clin Nutra, 2013. 8. Ancoli Israel S., Sleep and Aging, Prevalence of Sleep Problems, Sleep Med, 2009. 9. Capuccio F.P., et al., Sleep Duration and All-Cause Mortality, Sleep, 2010. 10. Xie L., et al., Sleep Drives Metabolite Clearance from the Adult Brain, Science, 2013. 11. Farashali Oda E., et al., Meta-Analysis, Melatonin for the Treatment of Primary Sleep Disorders, PLOS 1, 2013. 12. Shaw A.C., et al., Immunosenescence and Vaccine Failure in the Elderly, J. Clin Invest, 2013. 13. Nikoli Zujic J., The Twilight of Immunity, Emerging Concepts in Aging of the Immune System, Nat Immunol, 2018. 14. Franceschi C., et al., Inflammaging and Anti-Inflammaging, Nat Reverend Immunol, 2018. 15. Simpson R.J., et al., Exercise and the Aging Immune System, Aging Res Reverend, 2012. 16. Jack C.R. Jr., et al., Brain Atrophy Rates Predict Dementia, Neurology, 2004. 17. Launer L.J., et al., Midlife Blood Pressure and Dementia, JAMA, 2000. 18. Skarmias N., et al., Mediterranean Diet and Risk for Alzheimer's Disease, and Neural, 2006. 19. Freeman R., Clinical Practice, Neurogenic Orthostatic Hypotension, and Engel J. Med, 2008. 20. Rose K. M., et al., Orthostatic Hypotension Predicts Mortality, Hypertension, 2006. 21. Finnegan C., et al., Orthostatic Hypotension is associated with cognitive decline, Hypertension, 2014. 22. Kaufman H., et al., Treatment of Orthostatic Hypotension, Lancet Neural, 2020. 23. Madsen J. L., Graf J., Effects of Aging on Gastrointestinal Motor Function, Age Aging, 2004. 24. O'Toole P. W., Jeffrey I. B., Gut Microbiota and Aging, Science, 2015. 25. Vandepute D., et al., Probiotics and Constipation in Older Adults, Gut, 2017. Disclaimer: this content is for educational reference only and not medical advice. No doctor-patient relationship is created. You may share this article freely, but it must not be edited or republished as your own.